Heart failure is a condition that occurs when the heart can't pump as well as it should. So this may happen when the heart muscle becomes weak or stiff. So as a result of heart failure, the heart doesn't deliver enough blood to the rest of the body. This leads to the body getting less oxygen and nutrients. Heart failure can be a life-threatening condition, so it requires serious medical attention. Types of heart failure. So the main types of heart failure are named for where they occur in the heart. Number 1, left-sided heart failure. So this involves the left ventricle. So when the left ventricle doesn't pump enough blood, it leads to the blood backing up in the blood vessels that carry blood away from the lungs. So left-sided heart failure is the most common type of heart failure, and it tends to cause breathing symptoms. Left-sided heart failure can be classified further as heart failure with reduced or preserved ejection fraction. So in heart failure with preserved ejection fraction, the left ventricle can't relax normally. As a result, the heart can't fill with blood between beats and the things back up. Then in heart failure with reduced ejection fraction, the left ventricle can't contract normally, so less blood gets into the circulation. So ejection fraction is the percentage of blood the left ventricle of the heart pumps out every beat. A normal healthy ejection fraction is 55% to 65%. Number 2, right-sided heart failure. So this involves the right ventricle. So when the right ventricle doesn't pump blood well, blood packs up in the blood vessels that carry blood from the rest of the body to the heart. So this can push fluids out of the veins into other tissues, leading to swelling. Number 3, biventricular heart failure. So this is a combination of left-sided and right-sided heart failure. So this involves both sides of the heart and can cause a mix of both types of symptoms. So clinicians also classify heart failure as acute or chronic. Acute heart failure is any heart failure that develops suddenly, such as after heart attack or arrhythmia. Chronic heart failure develops over time from medical conditions such as long-term hypertension, coronary artery disease. Today we're going to talk about the causes of heart failure. Heart failure is usually caused by other health conditions, so let's first talk about the 3 most common causes of heart failure. Number 1, coronary artery disease. So this occurs when the arteries that supply blood to the heart muscle become narrow, causing the heart to work harder to pump blood. So eventually, coronary artery disease can weaken the heart muscle and affect the heart's pumping ability. Number 2, heart attack. So this is also called myocardial infarction and can cause a scar tissue that interferes the heart's ability to pump. So heart attacks are usually caused by the blockages in the heart's arteries. Number 3, high blood pressure, also known as hypertension. So this increased pressure on the walls of arteries can lead to heart failure. So let's also talk about other causes of heart failure. Number 1, arrhythmia. So an irregular heartbeat can affect the heart's ability to pump effectively. Number 2, cardiomyopathy. So this is a disease in the heart muscle that makes the heart less able to pump blood effectively. Number 3, congenital heart defects. So these are structural problems in the heart that are present from birth. Number 4, diabetes. So complications of diabetes can lead